Hello, my name is Evita Thomas, and I will be presenting on the basics of the Transtheoretical Model, also known as the Stages of Change model. In order to use any health behavior model effectively, you must first understand the basics. In this presentation, I will provide you with an overview of the background history of the model, the construct, and the limitations. So first off, we're going to start with the background of the Transtheoretical Model. The Transtheoretical Model of Change is a theoretical model of behavior change which was originally explained by Prochaska and Di Ponente in 1983. The Transtheoretical Model is a model of intentional change that focuses on the decision-making of the individual. This model has been used on the basis for developing effective interventions to promoting health behavior change. This model has also been applied in behavior modification techniques such as motivational enhancement therapy, which is used in smoking cessation and alcohol abuse treatment. The construct of the Transtheoretical Model consists of the stages of change, decisional balance, and self-efficacy. First, I will begin with the stages of change. It consists of pre-contemplation, contemplation, preparation, action, maintenance, and termination. Stage 1, pre-contemplation. In this stage, a person does not intend to take action. Simply put, this person has no desire to act. This could be due to not being aware of the issue or lacking the motivation. Stage 2, contemplation. In this stage, a person is thinking about changing sometime in the future, could be next week, or maybe next year. It all depends on the motivation. So the decisional balance process is when a person is thinking about taking action. Here a person will weigh their pros and cons for taking that action. This is an important construct to the Transtheoretical Model because this is where a person determines whether or not he or she will continue moving towards a health behavior change. Stage 3, preparation. In this stage, a person is ready to actually do something. In stage 4, action, this is the stage where a person has taken action, exactly what it sounds like, towards change. Stage 5, maintenance. In this stage, a person has made significant change in their behavior in terms of health risk and is now focused on keeping the behavior change and not slipping back into old habits. However, relapse can occur. So is the journey over? It depends on the person. Some people may give up for the feeling of failure, but it doesn't have to be the end. Relapse typically occurs during the maintenance stage. For most people, behavior change does not happen the first time. It's a constant struggle, as seen in the diagram. The Transtheoretical Model recognizes the process is not linear. Just because you relapse during the maintenance stage does not mean that you have to start all over and begin at the pre-contemplation stage. People engaging in behavior change should always remember, if changing a health behavior was easy, everyone would do it. Stage 6, termination. In this stage, a person has truly completed the process of behavior change. They're no longer tempted by their old unhealthy behavior. And although most people who have made a behavior change stay somewhere in the maintenance stage, some people actually go through the termination stage. And this is usually people that are dealing with addiction such as smoking, doing drugs, and drinking. So with self-efficacy is the confidence in the ability. Not only the ability to take action, but the ability to believe you can be successful in making this part of your everyday life. So there are 10 processes of change that have been identified, with some processes as being more relevant to a specific stage of change than other processes. These processes result in strategies that assist in helping people make and maintain change. So the first process, consciousness raising. In this process, you are trying to increase awareness about a healthy behavior through information, education, and personal feedback about the healthy behavior. Second is dramatic relief. This is the emotional arousal that the health behavior, whether positive or negative arousal, it can be a feeling of fear, anxiety, and worry because of the unhealthy behavior. Or on the opposite side, feeling inspiration and hope when you hear about how people are able to change to healthy behaviors. And this is used, has been used for health campaigns, health communication campaigns, such as in the Truth campaign, where they have very graphic information regarding cigarettes and the effects of smoking cigarettes. In this process, they're trying to get a negative arousal to associate with the habit of cigarettes. So on to 3, self-reevaluation. This is a self-appraisal to realize the healthy behavior is an important part of who you are and who you want to be. And next is environmental reevaluation, which is different from self-evaluation. In this process, a social reappraisal to realize how their unhealthy behavior affects others, not just themselves, but others, and how they can have more positive effects by changing. The next process, social liberation. In social liberation, the environmental opportunities exist to show society is supportive of the healthy behavior. Self-liberation, the commitment to change behavior based on your personal belief that achievement of the healthy behavior is possible. And this is part of the self-efficacy portion, confidence in your ability to change. Next is helping relationships, and this is finding people who are supportive and encourage the desired change. And this is typical in supportive groups. Some people find this supportive nature, this encouragement within family. Next would be the counter conditioning. And this is substituting healthy ways of acting and thinking for unhealthy ways of acting and thinking that you currently have. Next, reinforcement management. In reinforcement management, you're rewarding the positive behavior and reducing rewards that come from negative behavior. Okay, and then last, stimulus control. This is adjusting the environment to have reminders and cues that support and encourage healthy behavior and remove those that encourage and support the unhealthy behavior. So different strategies are most effective at different stages of change. For example, the counter conditioning and the helping relationships are most effective in the preparation, action, and maintenance stage. So if someone was in the pre-contemplation stage, this would not help them in successfully implementing health behavior change. And this is just a great example for health programmers who need to know why it is important to know their audience. In this model, the stage of change a person is in will affect the processes used that can ultimately affect the success of the implementation of the healthy behavior. Okay, and with every model, there are limitations. The first limitation would be that the theory ignores the social context in which changes occur, such as the socioeconomic status and income. This can have a huge impact on decisional balance process in the contemplation stage, where a person may ask himself or herself, can I afford to implement this behavior change? An example, although organic food is better for your health, it is also more expensive. So I might be motivated to eat healthier and eat organic food. However, my income might prohibit me from actually engaging in this positive, healthy behavior. Two, the lines between have a no set criteria of how to determine a person's stage of change. Questionnaires that have been developed to assign a person to a stage of change are not always standardized or validated. So basically, depending on your study, that will affect your questionnaire that's being used. So there's no standard way of actually indicating what stage a person is. However, if it's possible to just ask the person about the health behavior that you're trying to get them to do. If they show that they don't have any knowledge of this behavior, then that would clearly be a sign that they are in the pre-contemplation stage. So there are ways to get around the fact that there's no set criteria, just through questions that will give you enough information to indicate what stage this person is in. 3, everyone is different. There's no clear sense for how much time is needed for each stage or how long a person can remain in a stage. A person might spend a short time in the during the contemplation stage, maybe a couple days, maybe a couple months, while that same person can be in the maintenance stage for a couple years. Also, relapse can affect the time spent in each stage. And last limitation, the model assumes that individuals make coherent and logical plans in their decision-making process, when this is not always true. Most people are not methodical. They are not making lists about pros and cons when thinking about doing an action, such as it could be something as simple as going on vacation. Some people might pass the contemplation stage altogether and just proceed straight to the action stage. So, in summary, in the Transtheoretical Model, health behavior change involves progress through 6 stages of change: pre-contemplation, contemplation, preparation, action, maintenance, and termination. And they're associated with this are 3 processes of change that have been identified for producing progress through stages, along with decisional balance and self-efficacy. And I just included 2 tips for successful behavior change for public health programmers when they're creating these intervention programs. So the first would be when using the Transtheoretical Model, successful intervention programs are dependent on addressing the targeted audience at the appropriate stage of change, regardless of what kind of behavior is being addressed. And second, remember that there is a high risk of relapse. Not only does the Transtheoretical Model encourage an assessment of an individual's current stage of change, but it also accounts for relapse in the future. So I hope this presentation will be helpful in your progression as a public health educator or programmer. These are the references used for the presentation, and I want to thank you for your time.